Hello everyone, I am Paru Vandari. In this video, I am going to discuss about the current issue in healthcare setting. Healthcare provider is facing different challenges in the hospital while delivering care to the patient. Among them, higher patient-nurse ratio is one of the serious growing issue in the hospital. I would like to define the term patient-nurse ratio. Patient-nurse ratio is one of the methods used to measure nurses' workload in the hospital setting, where total number of patients are allocated to the nurse in their shift. Patient-nurse ratio method was established to maintain nursing staff and determine the care load. This method is currently used in 80 different hospitals in Australia. Currently, 1:4 nurse to patient ratio is operating in the state of Victoria, Australia. Discuss about the significance of patient to nurse ratio. The seriousness of the problem can be explained by increased patient mortality and job turnover of the nurses. The Department of Health Service California has stated that the increase of nurse-patient ratio to 1:6 will result in 1,500 additional patient deaths within 1 month of admission each year. According to Journal of Nursing Management 2006, higher nurse-to-patient ratio than 1:4 result in higher risks of readmission of patient for heart failure, pneumonia, and myocardial infarction. With all this data, we can say patient-nurse ratio is one of the serious issues in patient safety and work environment. This issue is not only the affect the patient, but it also affects the nurse itself. Now, I'm going to explain why this topic is so important to patient safety and healthy workplace. I have already mentioned the consequences and seriousness of high patient to nurse ratio. Higher the patient to nurse ratio, more likely there will be patient harm or death in the hospital. According to the research at University of Sydney 2006, 90% of interviewed nurses approved that ratio was success to manage their workload, where 90% approved the policy and 50% would leave nursing if the ratio was removed. By all the above information, high patient to nurse ratio is serious growing issue for patient safety and healthy workload. Thus, managing and understanding nursing patient ratio is very important to minimize such serious problems like poor quality of care and high workload on the nurses. To poor patient outcomes and low quality of care. Higher patient to nurse ratio also result in medication error, some of which cause harm or death to the patient. The standard of care practice required high engagement to the nurses, to high engagement of nurse and patient, but because of high patient to nurse ratio, nurse won't get enough time to engage with patient, which adverse the patient outcome. In context of patient safety, higher patient to nurse ratio leads to long hospital stay and increase in mortality. When therapeutic patient care depends on nurse having safe patient ratio, so currently different strategies have been made to resolve this issue. Creating a formal staffing plan is one of the best practice in healthcare setting. Creating formal staff plan also helps to healthcare organization to maintain staff number and hire more staff in crisis. Similarly, limiting mandatory overtime can be another important strategy to overcome nurse-patient ratio problem. It will help create safe workplace environment and result in better patient outcome by limiting excess workload on nurses. Likewise, using up-to-date technology is another currently used strategies in Australia. Nowadays, hospitals are using less paper for patient documentation and start using digital record which save a lot of time for the nurses. Also, observation machine and many more new technologies are being used in the hospital. Similarly, apart from trying to resolve this issue in high nurse-patient ratio, government and other stakeholders are working to lower the patient ratio itself. To reduce patient to nurse ratio, healthcare provider and university are encouraging more people into the field, which directly solve nurse shortage issue and able to provide better care to the patient. Lastly, providing individual consultation and emotional support to the nurses help to decrease work stress and fatigue and create healthy workplace. To resolve this problem, effective leadership can play a vital role in a hospital. In the nursing professional, leadership and management have different role play. Managers are assigned to positions with the more responsibility and power, where leaders are work within the personal despite of the position they hold. Transformational leadership can be one of the best leadership styles to resolve this issue, where the leader's attitude describe we can do it together. Similarly, to resolve this problem created by high patient to nurse ratio, manager, leaders, and nurses should work together to solve the problem and provide safe care to the patient. Leadership style also include motivate and inspire others by the behavior of the leaders. Leader can also empower and value the nurses, which encourage them to work effectively and create safe work environment. Mentoring and providing support is another quality of transformational leader which the leaders can use in the healthcare setting, and which also helps to create favorable work environment for the nurses as nurses also involving nurses in the decision making helps to resolve this issue by for the leaders. Now, let's discuss the role as a new graduate nurse. As a new graduate nurse, it is very challenging to resolve this serious issue independently. So, new graduate nurse will work as a team and support each other to mitigate this problem. By sharing their idea and thoughts about the issue, they can help their leaders and managers to resolve this problem. On the other hand, new graduate nurse can encourage and motivate their colleague by supporting and helping in needed. Another best way to provide better care to the patient by the new graduate nurse while facing high patient and nurse ratio is using time management strategies like shift plan, prioritizing the tasks, and many more. This helps to reduce work stress, fatigue, and safety either, which results in better patient outcomes. Moreover, new graduate nurse should always work under the scope of practice. Scope of practice in in a nursing refer to professional nursing activities as defined by the state law. It is very important to follow legal boundaries in nursing. There is no excuse to not to follow plan and procedure because of high patient to nurse ratio in the hospital. Nurse should always follow doctor order to deliver care in safe manner. It is very important for the nurse to work under the legal and ethical boundaries. Nurse ethics teaches nurses to care all patients fairly, equally, and provide them comfort. This PowerPoint video will help new graduate nurse and nursing student to learn about high patient um, to nurse ratio. This information provided in the video was from different articles and paper. Most of the article used in the presentation as a were peer-reviewed and systematic review. The aim of the using narrated PowerPoint for this presentation is to deliver information clearly to my audience through dot points, pictures, and video. Also, by adding audio in the presentation, I can explain my topic and dot points more clearly. The aim of the presentation was to deliver my knowledge about patient to nurse ratio to the audience. From the above information, now we all know how serious this issue is and what consequences it may occur in patient safety and healthy workplace. So, I will suggest my audience to focus on strategies and the role of the leaders to to mitigate this issue. Thank you for watching. Have a good one.